Hi, I'm Michael Potts. You might recognize me from HBO's True Detective. In recognition of the AIDS Council's 30th anniversary, I invite you to view a special video that highlights all of the great work this agency has been providing and continues to provide throughout the community. I am asking you to continue your support for the Alliance for Positive Health, a name that speaks to our mission and allows us to imagine a more positive future.
In the early days, those who were afflicted by the disease were invisible.
It was frightening.
People felt really alone, that they were going to die, and a lot of people were being rejected by their own families.
You were probably scared to even utter the words HIV, let alone seek help for it if you had the illness.
And fear that it generated further isolated an individual. So it was a death sentence and isolation and loneliness.
That's where the AIDS Council came in.
At a time when the world was running away, the AIDS Council was opening our doors.
So the AIDS Council was kind of a shining light out there that provided the support and the camaraderie, the understanding that I think was so needed back then.
That was a time when there was very little information about the epidemic medically in the community.
The AIDS Council were integral in getting us the information we needed, getting people tested. As the years went by, we knew more about it and we learned more about it.
Through our work with HIV/AIDS, we have not only championed that cause, but we have, as a result, champion a larger cause, which is health as a whole.
In serving people with HIV and AIDS for 30 years, we've learned how to help people who are facing multiple challenges get through very difficult and complex systems.
Many of the people that we serve are living in poverty.
There are people who do not have access to the most basic of needs.
Whether it's getting them to the doctor's office, whether it's talking with a counselor, whether it's putting food on their tables at night so they can feed their kids.
Going to their doctor's appointments, going to DSS to help them with their benefits.
The staff at the agency provide one-on-one care services to all of the clients and follow up and reach out, and they truly, truly care.
Because if a client is not stable and all their psychosocial needs met, they are apt to not take care of themselves.
Unfortunately, even after 30 years, there's still a lot of stigma attached to HIV and AIDS.
Changing the name from AIDS Council to Alliance for Positive Health was a very difficult decision. A lot of thought went into that decision because we wanted to make sure it was right, most importantly for our clients, right for the agency, and also right for the community.
The new name is a name that honors the people who have fought this disease for the last 30 years.
It's a very interesting blending of legacy and vision.
We still have our clients who receive AIDS HIV services. However, now that they're living longer, they also require other medical services.
We're just expanding what we do to incorporate another group of people who need assistance.
And that's what Alliance for Positive Health is. It's part of that change.
We're not only really changing a name, but I think we're changing an outlook.
So we're focused on today and tomorrow and next year.
But our core mission and the heart of the organization is not changing. It still will be working to prevent new cases of HIV and to support people who are living with HIV and AIDS.
Join us all of us.
Join us as we rededicate ourselves to our mission under a new name, the Alliance for Positive Health.